Hi, I'm Wayne Wrathall and I'm a consultant in intensive care medicine at the Dumfries and Galloway Royal Infirmary. I'm speaking from a single bedroom in our critical care unit, and I'm in front of an intensive care bed and a ventilator machine. Both of these are set up ready for use. Back in March, I couldn't have brought you in here and to show you this because at times all of our ventilators were in use, and in fact most of our beds were full as well. They were filled with young people, with older people, some people with underlying health conditions, but also some previously very healthy people. And we managed, because we've got an excellent team here, and there was really extraordinary cooperation across the hospital, indeed across health and social care region-wide. We had some great success stories, but we also had many patients losing their life to this illness. We also had to cancel many routine operations and outpatient reviews. And we also know that people avoided coming to hospital when they really needed to, with heart attacks, strokes, early signs of cancer, for example. But we all followed the guidance during lockdown, and as a result the numbers came down and the numbers of ill patients stopped coming into hospital. And we haven't had any COVID infection in our unit here from May until September, and we've watched, like you have, the numbers just begin to rise in the community. And now we are admitting people back to critical care with COVID-19 infection who require breathing support. And if the rates continue to rise as they have been, we may well be in a worse situation this winter than we were in the spring. And we're really keen to avoid that. We're keen to avoid cancelling routine hospital work, and also keen to avoid people losing their lives to COVID-19 infection. So some of the response to this wave of infection is in the hands of our politicians and healthcare leaders. But really the most important response is in all of our hands. It really is the simple things that will make a difference. We did it before and it worked, and we should try and do it again. But the reality is we've all got a bit fed up of being told what to do. We've all had enough of the virus. We've got COVID fatigue. But if we all cover our faces, we avoid crowds, we wash our hands, we maintain distance and don't socialise with others in other people's houses, we will reduce the transmission. I just want to talk a little bit now about what to do if you develop symptoms. COVID infection can produce a very mild illness, but it's still highly transmissible. So if you have any of the symptoms of infection, then you must self-isolate, however mild your symptoms are. The main symptoms are a new persistent cough, a high temperature, or a change in your sense of taste or smell. Self-isolation is tough. You must stay inside at all times. You must avoid contact with your family by eating away from them and by sleeping and spending the day in separate rooms from them. It's tough, but it's an awful lot tougher if you give the infection to your family or friends. If you do have symptoms, arrange a COVID test, but continue to self-isolate until you have been given the test result and advice. And if you do need medical assessment, please seek it through the normal channels. You may be asked to self-isolate if you have returned from overseas or if you're a close contact of someone with COVID infection. This is important even if you have a negative test, as the infection can take time to develop. Please remember that the hospital is still open for business, for routine planned care, but also for urgent care. We've gone to great lengths to make sure it's a safe environment for those who don't have COVID-19 infection. So please don't avoid seeking medical assistance if you're unwell. If you or your family develop COVID infection despite your best efforts, it's not anybody's fault. This is a very transmissible virus. But following these simple rules gives us the best chance of suppressing the virus without disrupting our lives. It's not enough just for a few people to follow these rules, it needs to be everybody, no exceptions. So please do your best to keep yourself, your family and friends away from this bed, these machines, and from me this winter. Thanks for listening.